Hi, everybody. It's Roberta Heel here for the Virtual Menopause Clinic YouTube channel. Don't forget to subscribe and check the links below because I always add a little bit of information for you, particularly the link to the Virtual Menopause Clinic website that has other resources for you to tap into. All right. Today, we're going to talk about something that is very disturbing that happens during menopause. Now, I know I've been giving you some bad news lately. And this isn't much better. I promise to tell you some good stuff that's going to happen to you when you go through menopause. But right now, we're going to talk about something else that is kind of upsetting, and it is hair loss in particular. Okay, so some women either grow hair in unwanted areas or they have hair loss. It really doesn't matter. It's not okay. Anyway, go through the introduction and we'll meet you on the other side. Okay, so there are a lot of things that can happen when you go through menopause. And to start, during the menopause transition, you might find that the hair on the top of your head starts to get thinner, and at the same time, you might start to grow hair on your face. Okay, the theory is that this is because of androgens, or what we commonly think of as male hormones. So yes, women have testosterone too. So because estrogen falls faster than testosterone during this time, the ratio of testosterone or androgens to estrogen is higher. And this is thought to be causing some of these changes. So I know, it is not fair. There are treatments, so be sure to see your primary care provider as soon as you notice these changes. There are other causes of hair loss for women during the menopause transition and beyond. Menopause transition, when I say that, I mean perimenopause, or the time leading up to your final menstrual period, which is actually menopause. 12 months after your final menstrual period is the definition of menopause. But anyway, so this is what happens during all that lead up and beyond. And the first is female pattern hair loss. Okay. We don't know exactly why it occurs, but it's thought to be because of the change in the ratio of estrogen to androgen, which we just described. But there are also genetics, because it does run in families. If you have female members of your family that have lost hair and have female pattern hair loss, you might be more prone to it. Environmental factors, so vitamin deficiencies, stress, diabetes, smoking, and high blood pressure. The hairline doesn't change in this, but the part widens as the hair thins. And it's rare, very rare, but some women might lose patches of their hair on their scalp, like with male pattern hair baldness. So, or hair loss, baldness, if you wish. Okay, see your primary care provider, because they can send you for lab work and they'll most likely take your blood pressure. So these are more reasons to stay healthy and keep your blood pressure under control during this time. Now, for a bit more bad news. The goal of all treatment is to prevent more hair loss, not to promote hair growth. Topical minoxidil is the only approved treatment. Some women are prescribed estrogen and menopause hormone therapy for female pattern hair loss. But there aren't any large research studies to confirm whether this works. Also, there are some anti-androgen medications, so to reduce that ratio of androgens to estrogen, but they're not recommended for women. And if they're prescribed, it's what we call off-label. Women sometimes develop hair on their face, as we were talking about. This is more like a peach fuzz above their lips in particular, or long rogue hairs pop up. Unfortunately, the treatment for female pattern hair loss can actually increase facial hair. Okay. Another problem, another hair loss for women is frontal fibrosing alopecia. And it's mostly in postmenopausal women, but it can occur in men and younger women. And it's an inflammatory condition, and it's thought to be an autoimmune response. It causes permanent hair loss in sort of patches. But not only on the scalp, but also eyebrows and eyelashes and body hair can be impacted. And again, there are treatments for this, but much like female pattern hair loss, the goal is to prevent further hair loss and not to have those areas regrow. Now, something that is not permanent is telogen effluvium. It's the second most common cause of hair loss during the menopause transition and postmenopause. And it occurs when there's a sudden loss of hair all over the head. And it's usually a result of a major life stressor, chronic illness, some prescription medications, or a hormonal shift. Now, some of you may have experienced this during postpartum, where all the glorious hair that you grew during a pregnancy is shed after the baby is born. This type of hair loss is typically temporary, as I said, and the hair regrows in about 3 to 6 months. It can sometimes be a little bit confusing because telogen effluvium and female pattern hair loss can occur together. All the more reason to see your primary care provider if you're having some trouble with this, because there are other causes of hair loss that have nothing to do with these. Thyroid disease, for example, is one. So you do need to be assessed, diagnosed, and treated, and do so quickly because it will help to prevent further hair loss. Bad news, I know, but the good news is that there are some treatments. Thanks for tuning in today. I hope you've enjoyed this episode, and be sure to subscribe so that you don't miss any of them. Do check out the Virtual Menopause Clinic website, because not only can you book yourself for an appointment, but you can also see other resources such as a webinar that I did about hot flashes and some blogs that I've been posting. So I do hope you have a great week.